I think the fundamental problems are things we've talked about all through the session. They're the fact that at the moment, access control passes for intellectual contribution. We need the data collection itself is a task that is required to be pre-specified and undertaken rather than happening agnostically. And so those are the exact elements that introduce bias. We saw, for example, even in simple interpretation of COVID data, ranges of cardiac involvement from 70% to 0. And trying to understand why it is that those types of problems have not been overcome for COVID, far less for all of the other common diseases that apply, is really an intrinsic problem in medicine. And I think the things that I believe will change it are the fact that as the scale of data that you require in order to be able to participate changes, people will recognize that building the architecture is just the price of entry, and that really it's creating the ideas and then testing these ideas and creating the ability to test these ideas that will be important. And then the other thing that will always drive change is outcomes. Once people start to see that outcomes are improving, then fundamentally the public will demand that we move beyond the current system. And I think some of this has been actively managed historically. It's nobody's fault. It's just a legacy property of the way that medicine has evolved over the last 300 years, is it is still very much intrinsically a one-to-one sport. And you talked earlier, Vivian, about, and as did Glenn, about the sanctity of the patient-doctor relationship. The sad thing is there are no data collected in those types of interactions that are worth using for AI. That doesn't mean to say they're not worth using for other activities, but for truly understanding the biology of a patient, they may not be that useful. And so we have to start to think about how we recreate what it is that all of the professionals in healthcare systems do. And what it shouldn't be is deciding what data to collect and then assembling these data post hoc in an attempt to answer questions that they themselves have had to think about before they started collecting the data. That cycle has to be disrupted, or we'll be stuck firmly in the 18th century for a long time to come.